This installment of the Crucible examines the reasons that patients give for suing their physician. And the paper comes from the Archives of Internal Medicine in 1994, and it's titled, The Doctor-Patient Relationship and Malpractice, Lessons from Plaintiff Depositions. The authors reviewed transcripts from 45 plaintiff depositions from malpractice lawsuits filed against a large medical center between 1985 and 1987. The transcripts were searched for where the patient was asked, "Why are you suing?" and the answers were noted. And just so everyone understands this methodology, 45 patients filed lawsuits. During the course of the lawsuits, the patients were deposed, the depositions were transcribed, and the author subsequently reviewed those transcripts. In response to the question, "Why are you suing?" 71% of patients cited problems with the doctor-patient relationship. In terms of specifics, 32% said that their doctor deserted them, 29% said that their doctor devalued them, and 26% said that their doctor hid information or delivered information poorly. The authors concluded, and I quote, "The decision to litigate is often associated with a perceived lack of caring." And that conclusion should sound familiar because this is the most widely quoted paper in the entire medical legal field. This is the paper that ushered in the communication era of risk management, and it served as the foundation for almost every lecture, paper, and program over the past 2 decades. But before we go any further down that road, I think we should take a closer look at this paper. And we can start by saying that the cohort was only 45 patients in one facility, which is a really small sample. We also don't know the sequence of the questioning. And this is important because at a deposition, the questions are usually sequenced to lead somewhere. So the placement of the question can affect the answer, but the authors didn't report that information. There are also some other technical shortcomings, but I'll just get to my point and say that this study should have never been done because the methodology is completely contaminated, and let me explain why. If you've ever been deposed, I want you to think back. Did you go into that deposition completely cold with no idea what to expect? Or did your attorney work with you beforehand, going over the questions that would be asked and the answers that you might give? Well, if you had a competent attorney, he probably worked with you because it borders on legal malpractice if you don't. Now, if your lawyer worked with you and you're a highly educated professional, do you think that plaintiff lawyers work with patients prior to their deposition? And remember, plaintiff lawyers work on contingency, which means that if the patient blows it, the lawyer doesn't get paid. My point is that these patients were probably prepared for these depositions. So let me give you some insight into that process. Over the years, I've attended a number of courses on trial methods. And one of the consistent teaching points is to present your case as a story. Don't present a bunch of abstract facts that people can't remember. Present a story that's impactful and memorable and to which the jury can relate. And the best place to get stories like that is Hollywood. The Hollywood movies all run on the same basic themes. There's good versus evil, the little guy against the system, conspiracy and cover-up, abandonment and betrayal. Those stories are universally recognizable and they always end the same way. Good beats evil, the little guy beats the system, and the guy who was abandoned and left for dead always comes back and settles the score. And that's the way the stories end because that's the way people want them to end. So as a lawyer, my goal is to present a story that portrays my client as the little guy and you as the system. Or to show that you abandoned my client, or lied to him, or left him for dead. Because once I do that, the jury's going to write the ending, and we all know what that ending will be. Now, with that as a background, let's look at this paper again. These patients filed lawsuits and are being deposed. Their lawyers undoubtedly prepared them for these depositions, doing so in accordance with the storyline that the lawyer was trying to develop. And the question is asked, why did you sue your doctor? The answers were, I was abandoned, I was devalued, they lied to me. I don't know where those answers came from, but they sound remarkably similar to the storylines that lawyers are taught to use. And if that's indeed where they came from, then we need to rethink our risk management approach. Otherwise, we're falling for the same courtroom theatrics that we fault juries for believing. Thanks for listening.